Hey everyone, good day to all. Today in this video, I'm going to discuss guys three most important clinical correlatives in the anatomy guys. So from this table only you are going to get one MCQ per sure. Okay, as the image based or one liner guys. Okay, so let's start. Please don't ignore this topic guys. Okay, the first one is the ERBS palsy. ERBS palsy. Okay, this one due to it is the injury to the upper trunk. What the hell is the upper trunk? In the brachial cyst guys, in the brachial plexus, you studied about the roots, trunks, division, cord, branches. Okay, so they are the C5, C6, C7, C8, T1. Okay, from this one guy, from the roots they form the trunk, from the trunk they form the division, from division they cut the cord, then branches they will give the ulnar or median. Okay, like that only. So this is the ERBS palsy. ERBS palsy is the due to it is this is the upper one, this is the lower, this is the middle guys. Okay now, so this is the upper trunk injury. Okay now, ERBS palsy. What is the nerve root? It is the C5 C6. This is the C5 C6. It means what? So see this one, this is the nerve root is the C5 C6. Okay, C5 means what? C means chudu. C5 C6. C very easy. C5 C6 C5 6. It's very easy. Okay, please remember this one. See, what are the nerves or which are the nerves are mainly involved in the ERBS palsy? See, from the C5 C6, what are the nerves coming from the nerves coming from the C5 C6? They are going to affect it. Obviously, see, all the nerves are going to affect it except the cum. Means what? See, cum. See, KUMPKES palsy, ulnar and median. See, cum. Okay, cum means, see, cum spelling C-U-M, cum. KUMPKES palsy, means ulnar median. Except these, all nerves are involved in the ERBS palsy. The most common is the axillary nerve, guys. Okay now. Next we'll study the KUMPKES also. Okay, see here, the most common is the axillary, but you have to remember the except cum, ulnar, median, all are involved here in the ERBS palsy. So what is the main cause? It is due to birth injury in the in the shoulder dystocia. The shoulder dystocia, guys, when the baby's head is stuck in the mother's womb, vagina, while the delivery, guys, when the baby's shoulder is not coming out, then we have to perform the different maneuvers. Still not coming out. If you are going to try, then there is a what? There is a injury to the trauma to the shoulder. Then there will be the what? C5 C6 nerve root palsy. Okay, so what are the examples? See, what are the features? See, arms are adducted. Elbow is extended. Forearm pronated, and the fingers are flexed. It looks like the policeman tip hand or waiter's tip hand or potter's tip hand. See the image. So these are the questions they are going to ask in the ERBS palsy. Next, coming to the KUMPKES palsy. Okay, KUMPKES palsy. KUMPKES palsy due to injury to the lower trunk. This is your lower trunk. Okay, lower trunk. So here the nerve root is a C8. Oh, C8 T1. 8 1. Okay, see, 8 having T only 8 only T only T1 is the only one, only T in the one. So 8 T1. See, 8 and T1. Nerve root is the C8 T1. Okay, so the main nerve is involved is the Okay, it is the ulnar and median. So there will be what are the feature? There is a plant. There is a hand. Okay, there is a hyperextension of the MCP. Hyperextension of the MCP. And why it is happening? There is a, and also there is a flexion at the interphalangeal joint. Flexion at the interphalangeal joint. What happened here? There is the paralysis of the lumbricals and the interosseous muscles. Due to this one, we'll get the KUMPKES palsy, guys. We have this there will be the hyperextension of the MCP. So this is what you have to remember in the KUMPKES palsy. Okay, the last one is the winging up scapula. Winging up scapula. Okay, there's going to be only one MCQ. What is the most common nerve involved is the long thoracic nerve. Okay, now what is the most common nerve involved in the winging of scapula? There is always one question. Okay, they will show the images also. Okay, now what is the nerve root for the long thoracic nerve? It is the C5, C6 and C7, guys. Okay, here right here C5, C6, C7 is the nerve root for the long thoracic nerve. Actually, why there is a winging? Why it is the cause of the winging scapula? Nerve is a long thoracic nerve. What is the muscle is paralyzed, guys? There is a serratus anterior. Serratus anterior muscle is paralyzed, guys. Serratus anterior muscle is paralyzed. Okay, now so there will be the see here, this is the medial type, anterior, superior, inferior. So which border of the scapula is having the more prominent? It is the medial. You see the medial border of the scapula becomes more prominent. You can see in the image, guys. Okay, so medial border of the scapula becomes more prominent. That's why there is a winging of scapula. So this is how you have to study the ERBS palsy, KUMPKES palsy, winging a scapula. Okay, so guys, thank you very much, guys.